my motivation for going to ENT is to really to help people. I think that's a fundamental part of all physicians. But otolaryngology offered me the opportunity when patients came to me with a problem to specifically address it, whether it's medically or surgically. And in my view and exploration of possible careers in medicine, it's one of the few specialties who are able to do that. The most rewarding factor from ENT gives me is the opportunity to help people. So people come to me with a problem. I can identify the problem. I can fix the problem, whether it's medical treatment or surgical treatment. I'm sort of the end of the line. There isn't anybody else to ask, anyone else to send them to. I can treat their problem. They'll generally get better, and then they go back to their normal lives. A candidate in otolaryngology needs to be a well-rounded individual. It's a very competitive specialty, and people are looking for a well-rounded individual, somebody that gets along with people and people would want to be around. Otolaryngology programs are not very big. They take usually between 2 to 4 residents a year. Most take 3. As such, there's not a lot of space for somebody who doesn't fit in or is kind of a jerk, because he'll stick out and everybody has to deal with this guy. So they really look for people who are compatible with the individuals who are already in the program. So I think the interview process is very important in otolaryngology. The threshold is to get to the interview, and then the choices of whether or not they choose you is based much on the personality and the interactions you have with the individuals at the interview process. Otolaryngology lends itself well to all physicians to have an active and family life. Because it is scheduled, you can plan your day. Although you work hard, and I think otolaryngologists work as hard as anybody else, it's scheduled. So there are nothing to drag you away from your family in the middle of the night. You know, if you're on call, you're on call. But if you're not on call, for the most part, you're pretty safe as far as getting called in. So it lends itself to family life in ways that other specialties don't. For example, general surgery would have well over half of what it does is on an emergency basis. In otolaryngology, about 95% of what you do is planned and scheduled. So that means that generally if the patient's sick, ill, unstable, whatever you're doing can wait until he becomes unstable and healthier to be able to proceed. So being primarily in ambulatory surgery, it really allows you to plan your day and to have interactions with your family, be reliably able to show up and to be there on time. One of the biggest challenges in otolaryngology will be the fact there aren't going to be enough otolaryngologists. There are significant shortages expected over the coming 20 years that will get increasingly worse with time. Exactly how that gap in the availability of otolaryngologists will be handled remains to be seen, but will be a significant challenge to the field overall, and a challenge to the otolaryngologists individually. And certainly the maldistribution of physicians will probably continue to some degree, but there will just be a significant shortage of physicians in the future. Otolaryngologists are good people. It's a very relatively small specialty in medicine, and there's great collegiality across the country in otolaryngology that impacts your application process, and that the letter of recommendations need to come from somebody in otolaryngology, and usually people know who that individual is. Where in other specialties, they're so large, people really don't know many of the people in the field. In otolaryngology, that's not the case. The chairman at a program in New York will know the chairman in California, or the one here, or the one in Texas, wherever it is. There's a Society of University Otolaryngologists where those sort of collegiality interactions are fostered, and the Society for Academic Otolaryngology Department Chiefs, where they meet with each other fairly regularly. So it's a small enough specialty. There's only about 10,000 in the country total, and in academic there's only 100 programs. So it's a relatively small group of people, and it's very likely that within a department of 4 or 5 people, somebody knows everyone in the field within the primary or secondary degree. So it's a really small field, and people know each other.